I am looking for a breast implant removal, brackets, textured closed brackets, with full capsulectomy / en bloc and uplift. Do you perform an en bloc technique? So, simple answer, yes. Yes, is the simple answer. Should we leave it at that? No way are we going to leave it at that. A lot of people, not a lot of people, some people get this en bloc word into their head. And I think they've been on the internet and all that. And I think the internet's great and it's good to have information and all that sort of stuff. But really, you don't need an en bloc removal. Now, this is a particular problem if you are thinking of having a capsulectomy and replacement of implants without a lift. So if you are going to have it without the lift, then you usually use the same incision you got, which is about 5 centimeters long in the inframammary fold. And what you do when you do a capsulectomy, so a capsule is the scar tissue that forms around a breast implant. For those who don't know what a capsule is, that's what a capsule is. And when it goes hard, after you've had your implants in for 5-10 years, that capsule goes hard, makes the implant uncomfortable. You can have the implant changed. You remove the implant, you remove the capsule, and you put a fresh implant in. And what you normally do is you dissect out that capsule, which is quite a hard ball, and then just before you take it out, you cut the capsule, you remove the implant, the capsule then deflates, and then that allows you to take the implant of the capsule out through the small incision. An en bloc capsulectomy is a capsulectomy where you take out the implant with the surrounding capsule in one piece, en bloc, one piece. The problem with that is you have to make a big incision to get that implant out. You can't get it out en bloc through that 5 centimeter incision. Now, in this case, it won't be too bad because this patient's saying they want an uplift. So when you do an uplift, you do make a bigger incision. So it might not be too bad if you're having an uplift, but nevertheless, it just makes things more difficult to get it all out as one en bloc. En bloc is really a cancer term that you don't want to cut into the cancer type thing. And I'm not sure why. I think why this patient is asking for it. I think it's become popularized for breast implant illness. I think people with breast implant illness feel that they need to have it en bloc removed, and people with and the worry about ALCL, which is that very rare cancer associated with implants, think that they might need an en bloc removal. If you have ALCL, then yes, maybe you would want to do an en bloc removal. But if you're just having it removed because you're worried about ALCL, well, if you're worried about ALCL, are you? Oh, maybe you're not having it replaced. No, it just says removal. I mean, so the answer is it can be done, but it might make your scars bigger if you are adamant you want an en bloc. I would say now you don't need an en bloc removal. You could have the implant, the capsule, just before you remove the capsule, you incise the capsule, you take the implant out, and then you remove the rest of the implant. It's still a total capsulectomy. Don't get me wrong. It's still a total capsulectomy. It is, but it's just not an en bloc capsulectomy. It's just a total capsulectomy and removal of implants. That is what the vast majority of people need, is a total capsulectomy and a implant removal. Now, having said that, a lot of people don't even do total capsulectomies, particularly if the implants are underneath the muscle. That posterior capsule is going to be right on the ribs. There's a risk of pneumothorax, making a hole into the lung space. So it's always difficult doing a total capsulectomy in submuscular implants. Not impossible, but difficult. So, it's something that probably needs a discussion basically in the clinic to say, look, what sort of risks are you prepared to put up with? Are you prepared to put up, if they are under the muscle, there is a risk. If it is difficult and if the capsule's really stuck to your rib cage, there's a risk that could cause a pneumothorax. Are you okay with that, or would you prefer that if we just left any capsule that's adherent? And do you really want an en bloc capsulectomy, in which case you might have to make your incisions bigger and your scarring more for a dubious benefit? I would argue I don't think there is a benefit in doing an en bloc capsulectomy versus just having a total capsulectomy. You're just incising the capsule just at the end, taking the implant out, then taking the rest of the capsule out. What's the problem with that? Why do you have to take it all out in en bloc? As I say, it's a cancer term used for a solid tumor that you want to take out en bloc. So that's where the term comes from. And I don't know, where it's come from in terms of breast implant surgery. But it is certainly out there. So that's where I am with it. So basically it needs a discussion. So can do it.